Welcome back. The Medical and Dental Consultants Association of Nigeria, MDCAN, has rejected the bill seeking to make it mandatory for fresh medical graduates to provide services to Nigeria for up to 5 years before receiving full registration and license to practice. The association, in a statement, said the bill being proposed by the House of Representatives was discriminatory and not in the interest of the people. The doctor stated that whilst passion and concern for the health of Nigerians demonstrated by the sponsor of the bill, Abiodun Ganiu Johnson, is commendable, the bill was, however, misdirected, ill-informed, and poorly thought through. This morning, we're joined by the National President, Nigerian Association of Resident Doctors, Dr. Emeka Innocent Orji. Thank you very much for joining us.
Thank you. Good morning, Nigerians.
Good morning. I'd like to find out what your thoughts were when you first saw the conversation about the proposed bill seeking to ensure that Nigerian doctors mandatorily serve for a term of 5 years before they consider leaving the shores of the country. What were your first thoughts?
Okay, good morning, Nigerians. Good morning, moderators. You see, over the past few years, we have been raising alarm for government to, trying to draw the attention of government to this very serious issue of brain drain happening in the health sector. Everybody seems to be leaving, doctors, nurses, pharmacists, everybody. In fact, it's not only in the health sector though, but if you consider that health sector is very important to the continued existence of any country, you will know that if you have that level of massive brain drain, then government should be worried about that. However, while we agree with the honorable member trying to find a solution to this problem, we have always said that any arm of government that wants to resolve this matter cannot do it without involving us, involving the people who are in the health sector directly. Otherwise, they are going to make mistakes. And that's exactly what just happened. You cannot seek to address a problem by taking care of the symptoms without getting to the root of the matter. Everybody knows, every sector knows that the major problem that is causing this brain drain is poor remuneration, poor infrastructure, inadequate security, inadequate funding of health. So if you do not address these problems, and you are going to bring up a bill that is an affront to both the provisions of the Nigerian Constitution and other enabling laws of the land, then it begs the question, because what they are trying to do is that when you graduate as a doctor, you do your housemanship for 1 year. That is what is obtainable now. And after that housemanship for 1 year, you are registered as a full-fledged doctor. So if you are not saying that these people, after housemanship, they have been fully trained to practice, and you're not going to give them license for 5 years, what exactly are they going to be doing for that 5 years? Do you want to create a pool of unregistered doctors who will be doing nothing? Secondly, if you go through that proposed bill, it will even be obvious to you that there was no adequate research put into that bill. Most of the figures the honorable member quoted there are wrong. We do not have 10,000 doctors in Nigeria, like he said. We are much more than that, even though we still know that the number we have is inadequate. Okay, now the other issue is, if you talk about subsidizing medical education, to what extent can they give us any scientific study that they have done to even find out the amount of subsidy they are talking about? Because it is just too simplistic to come and say that the medical education is heavily subsidized. Because what they do is that they just compare what we are paying in public schools with what they are paying in private schools and say that, okay, this one is subsidized. That payment is exactly for what? Because we know that even in public schools that pay high amount of money, it covers a lot of things that is not being covered by the tuition we pay in our public schools. Because after that tuition, you do a lot of other things. You buy your books and all that. The other issue is that, are you subsidizing it only for medical students? Is there any special subsidy? We are challenging them to prove to us that there is a special subsidy they are giving for medical students that they are not giving to other students. So why are they singling out doctors? That is simply victimization, And we keep saying this. We do not have enough doctors in Nigeria. But even the people we have are not gainfully employed. We have a lot of doctors on the street who have not been brought into the teaching hospitals and federal medical centers where they are needed. And indeed, other health facilities, because we have primary, secondary, and tertiary health establishments. These doctors can function there with adequate remuneration, with adequate infrastructure. We have also said severally that if you go around our teaching hospitals and federal medical, they are highly depleted of doctors. They need people there. But the bureaucracy of government will not even allow them to recruit people. And that was why a brain drain committee was formed last year to reduce this bureaucracy of bringing in clinical staff who have left the system, either by going to outside world or retirement or death and all that. Because as it is now, for you to even recruit anybody, the bureaucracy of government will not allow you to do that within 6 months. So that committee has come up with a one-to-one replacement that will reduce the time it takes for these our chief executive officers to employ people. But up till now, it has not been implemented. So the lawmakers are leaving all this, and they are trying to bring out a law that will enslave doctors in Nigeria. It is totally not acceptable. Again, we have been shouting about funding, appropriate funding for health sector. As long as you don't do that, if you like, enslave us for 10 years, it's not going to, people will leave. Okay? There is an Abuja declaration in 2001 where heads of states in African continent gathered to come up with a resolution that for any country to make any visible improvement in their health sector, that they are supposed to budget 50% of their annual budgetary allocation to health. This was in 2001. Nigeria was a signatory to that declaration. In fact, it held in Abuja, our federal capital territory. But up till now, year in, year out, Nigeria has never crossed 6%. So you don't fund, you don't have adequate funding. How are you going to now keep your doctor? How are you going to have enough funds to take care of infrastructure, to take care of remuneration, to take care of other things? We believe that there are better ways of resolving this matter, and we keep saying it. Any solution they want to bring about that does not carry us along is not going to work.
All right. I mean, you've said a lot that as long as you have not been carried along, the body, the doctors, the associations have not been carried along. Therefore, you've also pinpointed that there are some loopholes in that bill that definitely will not fly. One of them that I took note of is the misinformation, or better still, the disinformation that was being mentioned by the sponsor of the bill. He also went ahead to say that there is only one doctor to 30,000 patients in the southern part of Nigeria, and other parts of Nigeria. He did mention that the ratio to which a doctor to a patient is indeed something that calls for a quick action or attention. We do know that the health situation in Nigeria specifically has been very, very abysmal. We've not seen any improvement, hence why you have some of the leaders who would leave the country and go outside to receive a medical treatment. Even the number one citizen still does that. But should this bill be passed, what will this bring to the fold in the medical system for Nigeria? They say they're doing this to curb people from going. Do you think it will really stop the medical practitioners from leaving?
The bill, if it is passed, it is going to worsen the problem, because what we are going to have is that people will even not want to come into the medical profession. And when you have that dwindling number, you have not achieved anything, you have worsened it. Secondly, if you are a medical doctor and you've gone through that bill, you will know that that bill is not even going to stop people from living? Who told them that doctors cannot live without their license? If you say you will withhold their full registration, until 5 years before they leave, who told them that we can't still live? You see, the point is that because they are not involved, they don't even know why people are living. They don't even know how to address it. You cannot just sit in a chamber. You see, we want to agree with him that this is a problem. We commend him for at least trying to bring up a solution. But he now did it the wrong way. You must involve the stakeholders in the health sector for you to know why we are living, what is to be done to stop it. I remember that even last year, I think that was in either October or November, when we met with the Speaker of House of Reps, we raised all these issues. We talked about funding, budgetary allocation. As long as you don't address that, as long as you don't increase the funding that you have even agreed in Abuja Declaration to do, you are not going to solve this problem. That is the truth. So if the bill is passed, it is going to worsen the problem, I can assure you of that. But we believe that the people who are proposing this bill, they are watching the national outrage, and I will be surprised if they do. In fact, I'm expecting that even before the end of this week, that bill should be withdrawn. You don't even need to get to the level of public hearing. They are Nigerians too. They are watching what is going on. They want to find a solution to a problem, but they have done it the wrong way. So seeing the outrage should be enough to make them withdraw the bill and go back to the drawing board.
Well, so many angles to explore for this conversation. You've asked that before the end of this week, this bill be withdrawn before it gets, to become an official law. But we, of course, will be following this story. And if there are any changes, we would love to have you come back and join us on the show. Thank you very much for your time with us this morning.
You're welcome. Thank you.
Thank you.